The evidence ecosystem, it involves many organizations and actors working more or less together, although we want them to work much more closely together, to move evidence from primary research into practice. But we also want that evidence that moves into practice to then inform quality improvement and close the loop back around to informing what further research needs to be done. In terms of evidence synthesis, which is one of the key components of the evidence ecosystem, we're working to create and upgrade our review production and evidence synthesis tools. Ideally, we would have near continuous updating, and using machine learning and text mining, we can have evidence surveillance services that will hopefully identify evidence more or less in real time, so that at least we can flag that there's potentially new trials or new evidence available for synthesis.
What's interesting about the evidence is that the evidence is built in a context-free way. So it's built with methodology and statistics and is analyzed in a way that the evidence can be used anywhere. The challenge is that anywhere at some point becomes somewhere, and somewhere is different, and it's remarkably different site to site. And the same evidence might be difficult to implement even within the same institution. That implementation and the movement of evidence in different contexts is very challenging, and it's actually something I don't think we've quite figured out.
The technology in many ways is the easy part. It's the people and process elements that are the trickiest. And getting people to change the way they work, to connect the right human minds together, and get them to change possibly workflows or ways of doing things is the real challenge.
There are lots of challenges of engaging teachers. There's appetite to engage at a surface level, but actually that can lead to misinterpretations and misapplications of the evidence. And we're always encouraging people to get into the detail. Try and understand what's driving the effects that you see, not just think about the effect. When we started the Education Endowment Foundation, we felt as though one of the limiting factors in this system was a throughput of useful evidence on interventions and strategies and approaches that schools were doing. In the last 5 years, we've funded about 145 projects, looking at a majority of things that you might do in terms of education. And it's been surprising seeing which things are having the impact. It's not always the ones we thought. Doing systematic reviews that aggregate studies. Although they've been going on in education, the translation of that into guidance is something that's been really borrowed and extended from what's been going on in healthcare. We're currently writing guidance that takes our evidence, looks at it in the context of the wider research base, and trying to aggregate it into some kind of clearer, actionable recommendations that teachers can engage with and hopefully begin to implement.
The Worldwide Anti-Malarial Resistance Network is really a network. It includes over 260 organizations and individuals involved in malaria research that come together to share a platform, to share data, to share tools, and everyone really pushing together to try and enhance how effectively malaria is treated. One of the things that's unique about WARN is that it's a community of people that are both the providers and the users of the data. They have a common understanding of the burden of malaria, and it's a very integrated system. One of the advantages of the WARN data platform is when people share all available data, and we're now talking about over 100,000 patients in our database, then we can pull out the children that are malnourished or women that are pregnant and then see if they are a group that's at particular risk. The other thing that's worked really well for us is being able to have enough feet on the ground to be aware of what healthcare workers' challenges are, what researchers' challenges are, and especially what the questions are that policymakers are struggling with. So I think it's the close-knit network connections between these people that enhances the efficiency, the relevance, and eventually the quality of that data platform.